Hello, everyone, and welcome to today's session titled Promoting Better Communities for Older People, Building Economic Security Using the Elder Index. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in the control panel. You'll have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I'd now like to introduce Emily Baransy of Grantmakers and Aging and moderator for today's webinar. Emily?
Thank you. Welcome, and thank you everyone for joining us today. I want to extend a special welcome to our friends at Grantmakers and Health who are partnering with GIA to present this special conversation. We want to thank Archstone Foundation for their support of today's webinar, and we want to thank the John A. Hartford Foundation for their ongoing support of our webinar series. What is the true cost of growing older in America? Answering this question is the Elder Index, a tool that measures the income older people need to meet necessary expenses for housing, healthcare, food, transportation, and other essentials while staying independent in their own homes. The Elder Index was developed by the Gerontology Institute at the University of Massachusetts, Boston, with generous support from the Atlantic Philanthropies, the RRF Foundation for Aging, and other funders. Joining us today to share more about this important tool is Irene Frye, President of RRF Foundation for Aging, Len Fishman, Director of the Gerontology Institute at UMass Boston, Jan Mutchler, Professor, the Gerontology Department and Institute at UMass Boston, and Grace Egan, former Executive Director of New Jersey Foundation for Aging. Welcome to you all. As mentioned earlier, you can enter your questions for our panelists at any time in the question box on the right-hand side of your screen. We will read these questions during the Q&A portion. Irene, we will start with you to share about RRF Foundation for Aging's investment in the Elder Index. Welcome, Irene.
Thank you, Emily, and thanks to all for joining this webinar. I would like to start off with a brief introduction to RRF Foundation for Aging, formerly known as the Retirement Research Foundation. Though our name has changed, we remain singularly focused on improving the quality of life of older people. Our grant making supports cutting-edge research, advocacy, professional education, direct services, and organizational capacity building. In our 40-plus years of grant making, we have invested nearly $250 million in a wide array of aging-focused projects. Next slide, please. Throughout our history, we have maintained a strong commitment to promoting economic security. RRF renewed this commitment in our recently completed strategic plan. Economic security in later life is one of 4 RRF priority areas beginning in 2020. In addition to supporting the Elder Index, RRF has invested in other tools and services such as benefits checkup and economic checkup, pension counseling, professional training for those who help older people work toward financial stability, and advocacy to achieve system change, such as the resolution to the multi-employer pension solvency issues. We welcome a dialogue with you, whether you are a nonprofit with a promising idea or a funder seeking to collaborate on issues that affect older people or to co-fund a promising project. Please visit our new website, rrf.org, to learn more. Next slide, please. RRF is proud to be an early supporter of the research and development of the Elder Index and its first usage by state-based coalitions to inform policymakers about the real needs of older people. Today, you will learn about one state's highly effective use of the index. As I hope you will appreciate from this webinar, the Elder Index is a vast improvement over other measures that attempt to calculate the resources needed for an older person to live a dignified and secure life. The index considers the unique needs of an older person and the variation in costs in each zip code. It is clear that the basic cost of living for an older person from my hometown in northern Wisconsin will be vastly different than the cost of living for an older resident of New York City. The Elder Index provides real and up-to-date information about unique locations throughout the country. This type of data has the power to bring together funders, health, housing, and human service providers, advocates, and policymakers to effect real and positive changes that benefit older people across the country. Next slide, please. These next two slides are focused on questions and possible ways to use the index. The timing is certainly right to unleash the power of the index. There is a growing body of research that demonstrates that financial strain leads to poor health outcomes. Socioeconomic status is a social determinant of health. We need to consider how we might use the index to inform healthcare policy. Next slide, please. Here are 4 key questions to consider. How can we best reach and train service providers to encourage them to use the index effectively? Who are the key advocates that can use the index to improve public policy on behalf of older people? What role can the media play in educating and building awareness of the index? How can funders support the index at the national level and in their local communities? We hope that you'll keep these questions in mind as you listen to our presenters, and perhaps following the webinar, you will offer suggestions that lay the groundwork for working together. Thank you, and we look forward to hearing from you. And now I'd like to turn things over to Len Fishman.
Thank you, Irene. Hi, everyone. Next slide, please. Before we plunge into the Elder Index, I'm going to briefly discuss the other index, the one that has come to define for most Americans who among us is living in poverty. Next, please. Insiders know that the federal poverty level vastly understates the number of people living in poverty. Here's why. Next slide, please. The origin of the federal poverty level dates to Lyndon Johnson's War on Poverty. As his administration planned the war, it decided that a baseline measure was needed to record their progress in lifting people out of poverty. There was no measure at the time. The job to create one was given to Molly Orshansky at the Social Security Administration. Orshansky found a 1955 Department of Agriculture study that showed that the average American family spent 1/3 of its income on food. She figured, if I can price out the cost of food for an average family and multiply that by 3, that'll be the answer. So to do that, she looked at 4 different food plans identified by the Department of Agriculture, and she chose the cheapest one, the thrifty food budget. This was a bare bones budget for people in financial extremis. We're talking dried milk, dried potato flakes, dried peas. The Department of Agriculture itself called it a budget, quote, designed for temporary or emergency use when funds are low, end quote. Certainly not a permanent diet. The annual cost was $1,033. Orshansky multiplied that by 3 to arrive at the first poverty threshold of $3,100 a year. Next slide, please. She never expected it to become permanent. But in 1965, the Office of Economic Opportunity adopted this threshold. Orshansky warned that the formula yielded a conservative underestimate of poverty, and she sounded this warning for the rest of her career. But she was ignored. And we have been using the same formula ever since for over 50 years. Next slide. This, even though the underlying assumptions have changed dramatically. Here are two examples. In 1960, food accounted for about 17% of a family's budget. Today, it's more like 10%. That's a change of 42%. Next slide, please. Meanwhile, the amount spent on rent has gone from about 18% of a family's budget to approximately 30%. That's a change of 67%. But despite these enormous changes, the federal poverty level formula has never been adjusted, only increased for inflation. And yet the federal poverty level is ubiquitous. It's cited constantly and authoritatively, conveying that people whose annual incomes are below it are living in poverty, and those whose incomes are above it are not. This is simply not true. Now I will turn things over to Professor Jan Mutchler.
Thanks, Lynn. Thanks to everybody for joining us today to talk about the Elder Index, which, as Irene explained, is a measure of how much income people need to meet their daily living expenses and to stay independent. So the Elder Index sets a benchmark for what constitutes an adequate income that is more accurate and more realistic than the benchmarks that we typically use, including the federal poverty level that Len just talked about. Could we see the next slide, please? So the Elder Index is built around a budget for everyday expenses that are encountered by people who are age 65 and older. The budgets themselves are bare bones budgets. We don't include any resources for vacations or for dinners out. We don't include any savings. We don't include any taking gifts for the grandchildren, nothing like that at all. It's very basic budget. We adjust the budgets for singles versus couples, for housing status, and also for 3 levels of health. We assume that people live on their own, that they don't live with their adult children or in a group setting, and we calculate the Elder Index county by county for the entire U.S. Next slide. A report from the Congressional Budget Office recognized the unique strengths of the Elder Index, and in that report, they referred positively to these features. They commented positively on the unique element of its geographic specificity. They talked about its focus on elder-specific expenses and household-level measurement as a positive feature, and they noted that it's built using existing data, which means that we can update it and keep it current on an ongoing basis, which is, again, another important feature to keep in mind about the Elder Index. So with that background, let's talk about the 2019 Elder Index. Next slide. And we're going to go straight to the next one, please. Thank you. Okay, so let's start by looking at this empty table so we can get a sense of the components or the parameters of the Elder Index before we get bogged down in the numbers. So our basic approach involves estimating necessary monthly expenses for older people. For each county in the U.S., we estimate the costs separately for housing, for food, for transportation, for health care, and for other necessary expenses. As I mentioned a moment ago, we estimate these costs separately for singles and couples. We estimate it for 3 housing scenarios that you see here, the renters, the owners with no mortgage, and the owners with a mortgage. And once we've estimated the expense categories, they're summed to a monthly budget and then converted to an annual budget. And as I mentioned a moment ago, we do estimate costs for 3 levels of health, that is excellent, good, and poor health, but our illustrations today all assume good health. Next slide. So when we calculate all these expenses, this is what we get for the Elder Index, the U.S. national average for 2019. What the numbers that are shown in this table are monthly estimates for each expense category. So for example, the U.S. national average has a single renter paying $915 a month for rent and utilities. So that's that column that's headed single person, renter, and then you can read down the column to see the expenses. So $915 for rent and utilities. They need $257 for food, $259 for transportation, $395 for health care, and again, we're assuming good health, and $292 for miscellaneous expenses, things like paper towels and clothing. They need this every month. Again, in that miscellaneous category, all we have are the essentials. We don't have any of the items that I already mentioned as exclusions. So this is a bare bones budget. It doesn't include any non-essential expenditures. As you can see, for a single renter, the expenses sum to just over $2,000 a month on average, or about $25,400 a year. Next slide. This is the same information that we just saw presented in graphic form, and these are all in annual expenses. So you can see here very clearly the progression in costs associated with type of housing and the differences that are clear between singles and couples. Singles are the 3 bars on the left and couples are on the right. It's clear that housing and healthcare make up a very substantial share of the overall expenses. And another important observation is that for singles as well as for couples, the value of the Elder Index is far higher than the corresponding poverty threshold. So one important takeaway is that achieving economic security requires considerably more financial resources than staying out of poverty does. And I think this speaks to the point that Len started us out with, which is how the poverty line really is not a good reflection of what people need to get by. So far we've been talking about the U.S. average expenses, but as I mentioned, the Elder Index is actually calculated at the county level. So let's start looking at some of those geographic features. Can we see the next slide, please? So here we see 4 counties, and each of these counties overlaps with a well-known central city. The values here are once again for single renters in good health, and they represent annual averages. Across these counties, the Elder Index ranges from just over $22,000 annually in Shelby County, Tennessee, and that's where Memphis is. And the highest bar there is for Suffolk County, Massachusetts, where Boston is, and that value is about $37,000 a year. So just from those 2 examples, you can see the extreme difference geographically in cost of living that people are facing, even on a bare bones budget. For these counties, the costs of housing and healthcare are what drive the geographic differences most substantially. And in case you're interested, the Cook County value is $26,500, and King County, which is where Seattle is $33,300. So you can see a lot of variability in these counties. But in each of these 4 counties, and frankly for every county in the U.S., the federal poverty line is far below what it costs to get by. Next slide, please. So measuring economic security and disparities among older people is an important usage of the Elder Index. So up to this point, we've been showing you about what the Elder Index is and how we calculated it. And sometimes what people really want to use the Elder Index for is just that, just to get a sense of how much does it cost to live in this place. But very often people want to do something with it. And one of the things that we've been doing with it is to using it to measure economic insecurity. So let's talk a little bit about that. Next slide. So the Elder Index lets us identify an economic segment of the older population that we often miss when we're using conventional statistics such as the poverty line. Many discussions of economic vulnerability focus on those who are poor, people who have incomes that fall below federal poverty thresholds. By providing a more accurate benchmark for what it takes to get by, the Elder Index lets us think about who is economically insecure. including not just those who are poor, but also those who are what we call in the gap, people who have incomes above the poverty line but below the elder index. These individuals may have too much income to qualify for many programs that would help them pay their bills and stay in their homes, but they don't have enough money to cover their necessary expenses in later life. Next slide, please. So to measure economic security using the elder index, we compare the income that people have to the value of the elder index where they live. And when we do that, and as illustrated here, we learn that older people who live alone are at especially high risk of economic insecurity. On the left, our calculations show that 18% of older people who live alone are poor. That is, their incomes fall below the federal poverty line. But another third are in the gap. They live between poverty and the elder index. And the result is that half of older people who live alone are economically insecure. This is considerably higher than the estimated 23% of older couples who are economically insecure, as shown on the right side of your screen. But even for those couples, you can see that economic insecurity is far higher than is suggested by the federal poverty line. Only 5% of older couples live below the federal poverty line, but another 18% live in the gap. Next slide. My last illustration offers a glimpse of the geographic disparities that we see when we use the elder index. The focus of this map is the percentage of older singles who live alone with incomes below the elder index for their state. And what you can see is that there are very high rates of economic insecurity in New England, in New York, and New Jersey. Cody, can you click once or twice? Click twice. Thanks. So you can see Massachusetts actually has the highest rate of economic insecurity among singles at 62%, and New York is second highest at 60%. But you can see there are other states also that have quite high rates of economic insecurity for singles, clustered in the Deep South, California, Hawaii. Mississippi is at 57%. Now, clearly in the different parts of the country, you can see some parts of the country where costs of living are very high, such as the Massachusetts, California, and New York examples. So those are places where one of the main factors driving the high rates of economic insecurity is that very high cost of living. In other locations, like in the Deep South, the Mississippi example, people have lower costs of living. Rents may be lower, healthcare may or may not be lower, but incomes are very low. So you can really see how these economic insecurity rates are reflecting not just cost of living, not just the incomes that people have, but really the combination of those two. So the takeaway from this map is that in every state, at least 41% of singles have incomes that are below the elder index. But we do see that the risk of economic insecurity is considerably higher in some states than in others. Okay, Cody, could we go to the next slide? And we're going to try a minute to show the website that we've put together, through which anybody can go to this website and look up data for the community they live in or community that they're interested in. So let's take some time to just look at a couple of counties, and you can begin to see what kind of information is available on the website. So we were going to look at, very good, Adams County, Colorado. That is part of the Denver metro area, and we're going to compare that to Adams County, Mississippi, which is where Natchez is. It's on the Mississippi River. Okay, so we're going to look for singles and for renters and for people who are in poor health. Okay, so this is, you can see how it's easy to do that, and every county is listed in there, as well as the state averages. And when you look up data through this website, you get a chart that you can see the differences between up to 4 counties or locations. It splits it out according to the cost categories. It's clear in this example, the Colorado example, and the Mississippi example, that cost of housing is just a massive factor here. The cost of health care is actually higher in Adams County, Mississippi, than in Colorado, but it is just dwarfed by the difference in housing. So using the website, you can see this bar chart. You can download the bar chart. You can download the data that's embedded in the charts, and you can scroll down and get some additional information that helps people understand how do costs of living in these locations compared to national averages, compared to one another. Okay, so let's go. Pardon me? Yeah, the website address is just elderindex.org. So it's very easy to find, and people go to it. We make this data available for free. Okay, Cody, can we go back? All right, next slide then. Thank you. So we found that many organizations are using the Elder Index in their work. Some organizations use it for advocacy purposes, some use it for consumer education, and some for research. And there's some government organizations that use it as well for their own analytics. So we're seeing a rising interest in the Elder Index. Since releasing it, the 2019 version of the Elder Index, we've had great media coverage from many outlets at the national level as well as at state and local levels. And as we've discussed, a unique strength of the Elder Index is its relevance at that subnational level. For 2019, we generated a report just for Massachusetts that got a lot of media attention here, not just in Boston, but also in communities and regions throughout the state, precisely because the data are brought down to a more local level. So the Elder Index is really valuable at all geographic levels, and it gives people something to think about, something to use, and something to talk about. One place that has been able to leverage the Elder Index to very good effect, I think, is New Jersey. And so to tell us about that, I'm going to turn the conversation over now to Grace Egan. Grace?
Yes, thank you, Jan. Whoops,
Sure.
how about that? I guess the timer. Okay. Oh, thank you very much. Yeah, you know, we've had the benefit in New Jersey of using the report and starting work with national partners since 2008. And so it gives us a benefit in many respects. It has been utilized by the State Unit on Aging for a variety of reports, including their own strategic aging plan and for their testimony for the Older Americans Act. In 2015, the legislature required that the State Unit on Aging, which is within the New Jersey Department of Human Services, that they were required to develop it and to utilize it for their planning purposes. We have 21 area agencies in New Jersey, and they have used it since about, I would say, since 2009 to represent the need within their individual counties, because all 21 area agencies on aging in New Jersey are county-based organizations. So we're grateful that the Elder Index has always been done by county. It also has been used by funders and policy advocates. And so I think it's very important to understand the data that we've been able to actually drill down on. In New Jersey, we've customized the report over the years. We've also, besides the county cost of living, we've also broken down the demographics, and you'll see that as I go through the slides, who exactly is living under the Elder Index. And so we broke it down by gender, by race, by housing status, and that is both for the single and the elder couples. So you'll get a sense of that as we go through. It also has been used, I would say, for comparative purposes. Because we have had so many reports, we can actually see the difference year to year in terms of the change of housing costs, the change of health, et cetera. So it has been a very useful document for that as well. Next slide, please. Here you get a sense of the New Jersey Elder Index for 2019. And again, using Jan's grid as she's illustrated, you can see how the costs are relative over for the annual cost. So you can see the annual cost for a single renter is $29,616. And what's important is to see how the elder couple cost goes up. We know that there's no family Medicare plan, and so you can see how the costs double. I will actually say these costs are incredibly modest for the healthcare, but we are looking at a person in good health. And so we also know, after looking at the Elder Index, that 25% of New Jersey seniors live on or in poverty or on the edge of poverty. And that's a very significant number. So it's easily 250,000 seniors that we worry about each year. Next slide, please. The key findings of the data really let us know that 30% of New Jersey seniors rely solely on their Social Security. And the average Social Security for a woman in New Jersey is $17,286, and slightly higher for a man. Now, I just want to say, when we presented this to policymakers, sometimes I get the question, why is there a differential here? And we have to say, the women have had different work histories and different things like that. So it always amazes me when I get this question. And again, you can see the average expense for a single elder renter is $29,000. So you see right away, that is above the average Social Security for a person if that's their sole income. And the average expense for an elder renter is $40,000. Okay, so you can see that 22% of elder couples cannot cover their basic costs, and it's even higher for single renters. Next slide, please. Here, we're not only looking at the cost of living, but for the cost of healthcare. And now we're looking at a person in poor health. So you can see that the cost for a single renter jumped up from $29,000 to $32,000 for a person with poor health. And you can see how it's higher in all those categories. All right, so the other thing is, when you add in regional cost of community long-term care services, that is above the costs that they actually have been covering in terms of their basic expenses. So 6 hours, it brings it up to another $9,000, and 16 hours and 36. So you can see how, if you're a renter in an elder couple renter and your cost is already $46,000, and you add in care of 36 hours for one person in a couple, it brings it up for an additional cost. I think it's important to recognize too, since we've done this over several years, that we also have broken down the differences of when somebody's over 75 and somebody's over 85. And obviously those above 85 are the most economically vulnerable because they're further away in most cases from their earning years. And so that's a very important case. So we want to go on to the next slide now. Here you can see, as Jan represented previously, a barcode representing the costs. And you can see, if we were drawing across the federal poverty level, that we would be looking at people who were the federal poverty level of being $12,000 for a single person and $16,000 for a couple estimate. So anyway, so we have, what we really are looking at again here is good health for people in good health. And you can see again that the owner with a mortgage has the highest cost, whether they're a couple or whether they're whether they're single. So let's go on to, what does this really mean? So let's look at the next slide. We sort of titled this, So What? This data really created a new profile for seniors living in New Jersey on the edge of poverty or in poverty. This was a surprise to many of our policymakers and to people who were in middle age and trying to decide how they were going to live later in their life, and for younger generations. And so it's always interesting to me that people are really very far away from what it really costs to live in their town, and what it means for them in terms of their future planning. So you can use the Elder Index to tailor national, state, and local policies and use it to focus the discussion on the quality of life issues and hopefully to provide enlightened financial planning forums. I think this is very important because you can look at the costs and be overwhelmed, but if you're still in the middle of your earning years, you can use it as a better planning tool. Next slide, please. So this really helps people identify the myths and use it as a reality check. In the conversations with policymakers and and the general public in New Jersey, we frequently heard, well, all seniors have free health care. Those of us on the line here know that seniors do not have free health care. They have their Medicare payments, often they have their Medigap, and they have a variety of other services, including their prescriptions that they have. And from housing folks and local planning, you often hear greedy seniors want to keep their large family homes. Well, you'll see the reality check is that oftentimes there's not places for them to go. And then, of course, that's seniors living well in their golden years. Well, if you have 25% of your seniors who cannot cover their costs, these are certainly not golden years. So looking at the reality check, we have 16% of single renters whose costs are per month are higher than they really have the ability to cover. We have 30% with mortgages at 65. And again, I was always surprised. Why do they have mortgages when they're over 65? Well, they had a new furnace. They put people through college. They had a catastrophic illness. They have a variety of reasons why they still have mortgages when they're over 65. And then we know that 49% of monthly costs for single renters are really for their housing. And oftentimes, the person who is living in their own home that they have owned or that they still have a mortgage, they do not have an affordable option within the town where they've lived, raised their children, where they have their support systems. And so the reality of it is there's no affordable housing in their area. It's just not that easy. Next slide, please. As I've mentioned, over the year, okay, next slide. That's different than what I thought. So, okay. So again, because we've looked at the demographics, we know that 48% of owners without a mortgage live below the elder index. And the important thing here is that we really realize that 63% of the people that live below the elder index across New Jersey are women. 37% of them are men, 22% of them are minority elders. But when you drop down, you can see that 60% of them are over age 75 and 23% are over 85. This really lets you understand, excuse me, as they go through their later years, that they really have less resources to cover their basic expenses. Next slide, please. Because we've had the benefit of several years, we can now look at a chart for Bergen County and we can actually tell you how the costs have increased using the elder index. And this is true of all the counties in New Jersey. So sometimes the differences are small, 2%, but sometimes the differences are 11% or more. So it's very intriguing. So we won't spend that much time on this, but you can see how Bergen County, which is in the northern part of New Jersey, their renter costs are here for a single elder in good health is $32,000, and it's much higher than the average, which is $29,000. And again, here you can look at the owner with a mortgage and you can see how their expenses are actually higher in this particular county. Next slide, please. In this slide, you can see, again, that now we're looking at a person in poor health, and we can see that this is their housing expenses in the top bar. And when you add in the cost of community long-term care services, what their additional cost would be for 6 hours, which would be $9,300, and for 16 hours. And so you can see that these costs really make living below the elder index even more dire when in fact you need the additional care. And again, for the person over 85, they are really the most vulnerable. And again, keep in mind that as we look at the future slide, you can see how it impacts the gender difference. Next slide, please. Okay, we can see here that 66% of the women in Bergen County that live on the edge of poverty, 66% of the people below the elder index in Bergen County are women. And you can see that almost 20% of them are minority elders. And those that are over 75 of those living below the elder index, that's 87%. So you can see that when you can use the basic tables and drill down even further, you can get a lot of information. When we did this, we did the racial differences. We had African American, Latino, and Caucasian. And so you can really drill down further, but it's really important to have the basic tables to be able to do that. We gathered with a lot of stakeholders over the process. Next slide, please. And so what it really enabled us to do was to work with other stakeholders and to work with trying to improve the access to public benefits. So here I have to say, as Jan showed you and as I showed you, the housing costs were the most expensive thing for people in terms of their everyday and costs. And so housing options was really the first thing that we thought could make a difference, but it was the hardest one to do. We looked at food and nutritional supports. That was the easiest one to kind of do a better match. If somebody was eligible for pharmaceutical assistance in New Jersey, they were more than likely eligible for SNAP. And so it was really important to do that match. And we saw a 100% increase in SNAP applicants of seniors over 6 years, from $64,000 up to 122,000 seniors. And that was just working with the State Unit on Aging, the Department of Human Services, our local anti-hunger programs, and having everybody understand that there was a gap in terms of seniors being not represented in the SNAP programs and nutritional programs. The other thing was to widen the access to community-based services, and I really think in terms of some of the Medicaid changes, that has really helped, and to look at aging in place programs, and to look and explore tax rebates and programs in New Jersey. So the use of the Elder Index, I think in terms of area agencies on aging, local planners and funders, it can really create a new base for outreach programs, for planning, and as a case management tool. So you can gauge the progress for a vulnerable adult in terms of improving their quality of life. And for the person at the policy level, you can use it to determine how the impact of public benefits really improve the life of seniors in different, within the different cohorts, in terms of making sure that they're getting the benefit out of public benefits and really improving their quality of life. And I think that brings us back to Emily at GIA.
Great, thank you. Thank you so much. Thank you all. So we will turn over to our question and answer time now with our panelists, and we have several questions that have come in. I want to remind you that you can still enter your text questions on your control panel. So we'll try to get through as many as we can. And the first question, and I think I'll ask this to Irene, and this is thinking about how funders can be encouraged, or strategies that they can use to promote the use of the index.
Well, thanks for that question. Well, one thing that funders could do is invest in training health and aging service networks to use the Elder Index as part of their overall assessments and diagnostics with their clients. It is also useful to help older people who may not think about seeking benefits for which they're eligible, like Medicare savings plans, SNAP, because of stigma, and to help them get a better understanding that high costs are out of their control in some instances. Thus, they can use this tool to help access benefits.
Great, thank you so much. So this next question, and this could be to anyone, if you've looked at changes over time in the specific counties, so maybe over the last 10 years, if there's been any analysis on that data.
This is Jan, I can address that and Grace might want to talk about New Jersey as well, but on the national level, we've been generating these numbers for about 10 years, and without getting into the details of specific counties, it's certainly fair to say that overall the costs have gone up more dramatically in some areas than in others. The cost of housing in particular has gone up dramatically in many counties. They're the counties that are in the news all the time about the high cost of housing, particularly the high cost of rents. So we often don't think about how the spiraling renter costs impact older people, but they do. And so that has certainly been demonstrated. But overall, we see significant increase in costs over the period of time you've been doing that. A lot of it is in housing, and secondarily, it's in medical costs.
Yeah, and this is Grace. We have done the comparison and used it to work with area agencies on aging. And going back to Irene's point, I think oftentimes seniors are reluctant to apply for services, and it's important for the professional staff to understand how an increase in property taxes or an increase in utilities and a variety of things that impact a senior, and also the idea that their prescription costs may have changed, really is important when in fact they don't see a cost of living increase in their Social Security to match the cost of living that they're seeing, or they no longer have the benefit of seeing any earned income that can really match their rising costs. So yes, as I said, sometimes it was a low percentage, sometimes it was 2%, but we've seen up to 12% in some of our more urbanized counties that have restricted housing and are not necessarily building affordable units. So it's a very important issue. And we saw that when somebody actually applied for SNAP and were participating in their nutrition programs at their local level, that they could really improve their quality of life and also have a cash benefit in reality that they could pay for their basic expenses. And this could be run from $1,200 to $1,500 a year, which is significant when someone is really living that close to poverty.
Sure, thank you so much. This next question is thinking about how the index is adjusted for people who are in good health versus people who are in poor health, and how do those expenses change as a result of health status?
Yeah, this is Jan. The expenses, it is a little bit variable from county to county because we do, essentially we assume full health insurance coverage, and so we build in a Medigap plan or Medicare Advantage, and those costs themselves vary across locations in the U.S. But in general, the costs for someone in good health is somewhat higher than people where we assume they're in excellent health, but the gap often is not that substantial. But once someone is assumed to be in poor health, typically the healthcare expenses go up very dramatically. So that's again a place where you're looking at, as Grace was talking about, the oldest people, the people who are single, essentially the vulnerable groups are really impacted heavily by very high costs.
Sure. This next question is for Grace to describe a little bit about how the legislation in New Jersey is using the Elder Index, how that was introduced and adopted, and then if you have strategies on how others can engage their policymakers in their own state.
Well, I think it's a great question, Emily. Thank you. Having used the Elder Index for so many years, in 2013, we really started working with a national partner who felt that codifying the use of the Elder Index would really help local planning. And so meeting with local legislators is really important because their constituency contacts are often problem-solving moments. But when you give them this data, they can be more sensitive to what they're seeing their constituents are bringing into them. And so we readily saw a little surprised, as I said, that the cost of living was so high, or that there were so many people within their districts that were living on the edge of poverty, that it really kind of energized them to understand what they could do. And across the board, understanding that, you know, single renters who happen to be women or happen to be within a minority group were really stressed in terms of living, that they got together and they understood what an important local planning tool it was, but what it meant in terms of the state benefits programs. And New Jersey, we're fortunate to have state benefits programs, but at the same time, you need to recognize that it's a routine piece of data that you need to look at. And what does it mean in terms of the gender, the cost locally? What does it mean in terms of affordable housing policy? What does it mean in terms of local programs, local tax benefit programs, and utility assistance? And when someone's, as I said, is eligible for utility assistance or tax rebate, they're probably eligible for other programs. And so that enabled a match across the departments. But by using and codifying the legislation, it meant that it was going to be used for state planning in terms of a strategic aging plan, and it's also used at the local level. And so it bubbles up, and I think getting local legislators on board means sitting down with them, sharing the data with them, drilling down. We were able to get another partner locally that could take the data and tell us who was living below that. It's important. We have a high population in New Jersey, so it wasn't that difficult to drill down within the census tracts to figure that out. So I think it's very helpful. It took 2.5 years, and the legislature passed it, and then to our amazement, there was actually a budget dollars that were thrown in there too that could actually do the work.
Wow, that's excellent. Thank you. Sorry, go ahead.
Irene, and we've also noted that funders like United Ways are using this to facilitate stakeholder coalitions that use the index to educate policymakers and government entities. And some United Ways have been very successful in engaging advocacy that has created senior tax levies that help to address some of the unmet needs in their own communities.
You know, I just want to jump back in and say for a second, this is Grace. You know, what enabled us to do was to sit down with the Anti-Poverty Network to have them understand that while they were working with families and minority groups, oftentimes they weren't necessarily including elders. So it was a new platform to work together and coalition build. And the same thing true, housing, as I said, is the biggest reach, the hardest get, and yet it means so much to those living below the elder index. So since 2017, we really broke through in terms of talking with the housing coalitions and having them recognize, so that aging in place programs are now being able to work within their communities to talk about affordable housing and what it means for seniors that want to relocate, sell their big house and live within the community. So it does, as Irene said, it really does enable, you know, not only policymakers, but people on the ground who recognize this data and what it can mean for local change.
That's great. And we have time for just one more question, and this one is for Janet Ortland, and it's thinking about the Aging Services Network and how can those service providers use the index, and who else could provide this service?
Well, one thing that we've seen, and we see it very clearly and immediately in Massachusetts, but we've heard about this in other states, and Grace touched on this. Advocates love being able to meet with the legislator having very local data. State data, of course, is useful, but as the Elder Index makes clear, the variability is so great that when you can zero in on a county and show what's going on there, that really gets the attention of elected officials. And it is a foundational item for people who are doing advocacy here. One thing that I want to mention that we didn't have a chance to cover because time was limited is that Jan produces other reports that look at the Elder Index by race, ethnicity, gender, and age, meaning older, old, and very old. And the disparities are enormous. And that's something that some of you may be interested in learning more about.
Great, thank you. And we can do our best to send everything out following the webinar. So we are getting close to the end of our hour, so I want to close by asking each of our presenters for their final words of wisdom. And Irene, we will start with you.
Okay, thank you. Well, thank you, of course, to Grantmakers in Aging and Grantmakers in Health for hosting the webinar, and to our colleagues at Archstone for supporting it. But thanks to the other presenters for informing and inspiring us. And we hope that this will be the start of a robust exchange of ideas and an opportunity to join together to use the power of the Elder Index on behalf of older people. And thanks again to all of you who dialed in, and we're very happy that you could join us.
Thank you. Len.
Yeah, thanks everybody for joining us. And I want to just offer thanks in particular to Irene and Grace for their support. So what I would say is that the Elder Index has many uses, and one of the most important, I think, is helping us change the narrative of poverty in America, especially as it applies to older people.
Thank you, Len. Jan, final word.
Yeah, thanks everybody. I get my final word is that location really matters. The Elder Index demonstrates that. It is a unique tool, and I think it can be highly effective for many purposes. And I will just chime in with what Len mentioned, that I hope that you will keep up with our work on our website. You can find reports, and that disparities report that Len mentioned about race and age and gender, that's going to be up this spring. So look for that.
Great, thank you. And Grace.
Well, you know, I think the new data opens up new dialogues and the opportunity for new partners and new strategies to wrestle with programs that problems that have been with us for a while. And so I think it's an opportunity to really, as Jan and everyone has said, to look at seniors and look at the difficulties they might have that might be hidden away. And so I think there's an interest out there, and it's for everyone's benefit because we all want to age well. So thank you.
Thank you. Well, I want to thank Irene, Len, Jan, and Grace. Thank you for all that you do to make life better for people of all ages. I want to thank Archstone Foundation and the John A. Hartford Foundation for their support of today's webinar, and thank you to our friends at Grantmakers in Health. We will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio. Watch for an email to be sent within a few days, or you can visit our website. And finally, I want to thank all of you for participating in today's webinar. Have a great day.